All right, welcome to the Autoimmune Doc podcast. As always, this is your host, Dr. Taylor Crick, and I love explaining the mechanisms underlying autoimmunity and chronic and complex illness. And I'm here today with another doctor that also loves basically the same thing, Dr. Ben Weitz. And so Dr. Ben Weitz is the host of the Rational Wellness podcast. It's an awesome podcast with a bunch of episodes and a bunch of great interviews, and also YouTube and Instagram and all the, channels that are out there. But welcome, Dr. Ben.
Thank you so much, Taylor. Welcome to your audience, and thanks for having me.
So the first thing that I have to say, I told you that I was going to jump in with this, but I had to confirm with Dr. Ben because I heard him say on a podcast that he was 66 years old. And I said, "How old are you?" And he said, 67. And I know Dr. Ben. We've done podcasts together and I've seen him online and stuff. And I would have just had no idea. And I think that I wanted to start with this and just get your opinion on this too. Dr. Ben has had a health crisis, and we're going to talk about his story and his journey and just the things that he's learned and what he's went through and just how we apply that, to especially around bone health. It was a bone related crisis. I'll let you tell the story, but that's what we're going to get into. But the first thing I wanted to say, just because of that, is I love chiropractors, and I always admit that it's an opinion and it's a bias, but I think that chiropractors make the best functional wellness doctors because of our education and knowledge and physiology and things like that, but also because of our principle too of like put the body in the right position to heal, and the body heals. I mean, the body wants to heal, and I think the bones are a great example of that. You typically you set a bone, it heals, and it's almost miraculous, but it's almost something that we take for granted. But I just wanted to I don't know if you have an opinion on that or if you agree or disagree. You and I are both chiropractors, so again, I'm biased. We also have very similar backgrounds. I have a sports medicine background from Colorado State, and so just you're a sports chiropractor, certified sports chiropractor.
Yeah.
But what's your opinion? Because you've interviewed, hundreds of people in the wellness space. Do you think I don't know if I don't want to say we're not better than anybody, but I think that we are often rubbing shoulders with naturopaths and MDs and DOs, and a lot of times it just kind of blends together. We all kind of preach the same thing, but I just tend to think of chiropractors, and just again with you and your young looks, as being so typical of chiropractors. I got a buddy here in town, last thing I'll say, but I got a buddy here in town who's, I don't know, in his 60s, but you'd never know it. He's been in practice 30 years. He's like, seems younger than me, and I'm pretty fit and pretty in shape. I'll just say in my 40s. But what's your opinion of chiropractors just in general in the role that we fill in this space, Dr.
No,
Brown?
I totally agree with you. I've always been amazed at how many times you talk to some of the smartest functional medicine doctors, whether it be Datis Karazian or Tom O'Brien, or I can go on and on and on, and how many of them are chiropractors. And yet a lot of times chiropractors get no respect, which is kind of silly. If you're on Instagram like I am, how many times people troll you and go, "Oh, you're just a chiropractor. Why are you talking about science or medicine or something?" Which is ridiculous.
Well, it's like a second-rate citizen, but it's, again, we've talked about it, that it's just fulfilling. We see great results with people who the medical system has failed them, quite frankly, or they're just kind of reached the end of their rope, let's say. But it's very fulfilling. So you and I think, are happy with our, career path and things, but it's definitely a different experience. But I'm glad that you agree with that.
Yeah, I totally agree with that. And you're right about getting the body in position so it can heal itself.
Yeah.
And that really is the key.
Well, and so tell us about, let's jump into, tell us your story.
Okay. For years, I even though I've been involved with functional medicine, I never had the major health crisis. So many times you hear a doctor say, "Oh, I had this horrible gut problem and parasites, and I just was in bed and I couldn't function, and that's what led me down the path of becoming a successful doctor or functional medicine practitioner or whatever." And I've been to seminars on speaking where they say, "Well, you have to talk about your health crisis." And I'm like, I never had a health crisis. I'm fortunate I didn't. Well, anyway, I finally had my major health crisis in my life, which was on Halloween night in 2023. I was doing the incredibly risky act of handing out Halloween candy to kids. And unfortunately, I had socks on, and we have a wood floor at my house. And I had a bowl of Halloween candy in my right hand. And I have this dog that's very energetic. And I wanted to make sure that she didn't jump and start licking on all the kids. And so I had the dog's leash on my left arm. And so I had handed out some candy and I was backing up, and the dog pulled, and I had something in my hand, and I just went down on my hip. And at first it didn't seem like that big a deal. And my wife was there and she said, "Oh, I'll help you up." And then I looked down and my right leg was rotated out. And I thought, that looks odd. I wonder why that is. I think I'll pick my foot up. And then it wouldn't move. And I said, "Oh no, my leg is broken. You better call the paramedics." And so that was the start of my first major health crisis I've ever had in my life. And so I went to the emergency room and I ended up having surgery the next day. And they put 2 steel rods inside my femur, which crisscrossed and attached to each other. And after that, the bone was supposed to heal as normal, except that for whatever reason, instead of the bones being like that, which is what's supposed to happen if you want bone to heal, it was like that. And there was a gap. And that creates a challenge for the body. How are we going to bridge that gap with bone? And so I kept going in every month for an x-ray, and every month, nope, there's still a gap. No, there's still a gap. And the gap hadn't filled in with bone. So after 4 months, I was informed by several orthopedic surgeons that we now had to classify this as a non-union, and that if it hadn't healed in 4 months, it wasn't going to heal on its own, and that we needed to go in, pull the rods out, start all over, do this revision surgery where they put this rod down the outside of my femur with all these screws. And I looked at this diagram of what they wanted to do, and I just said, there's no way. I'm not doing that. And
meanwhile, you're probably disabled to some degree. What
right.
happened with were you on crutches? Were you in a wheelchair for
okay. Yeah, so I was never in a wheelchair. Okay. I actually, the next day after surgery, I insisted that the nurse help me down the hallway to walk with a walker. And a week after getting out of the hospital, I was in Gold's gym with my walker doing upper body workout.
Nice.
Because as you probably know, and some of the listeners know, when you fall and break a hip, that can be the beginning of the end. A lot of people die from that. They go downhill, they get deconditioned. And I was not going to get deconditioned from this. So I was going to get back on my workout schedule, even if I could just do upper body and machines. And so I was at the office for a couple of months, and then I was hobbling around the office with a crutch, but I still had essentially a broken leg.
And you were probably expecting that it was healing on the inside. You couldn't see it, but maybe after the x-rays, but you came to the point where they declared it a non-union, and then they, as you said, laid out their plan, and you didn't agree with that. So where did it go from there?
Yeah. So first of all, my thinking was not that I just didn't trust this surgeon, but that I know, as you were talking about, as a chiropractor, we know that the body has amazing ability to heal itself. Sometimes it needs some help. There's an obstacle and it needs some help. So what do I need to take away? What do I need to put in to help my body to heal? And I also knew that simply pulling the rods out and starting all over, that sounds like an easy thing, but it's not that simple. Right. First of all, those rods, I'm sure, were connected to my bones, and they would have had to chisel them out, then creating a hole in my femur. And you can't just pour cement and fill it up again. So right now, I ended up not getting the surgery, and those rods are inside my femur. I can't feel them. There's only one screw on the outside. and I can barely feel that. So it's actually an elegant surgery when it's on the inside. And I decided I was going to figure out a way to get my femur to heal on its own. So I had the surgeon actually tell me, well, look, you need to get this surgery. And if you don't, your leg's going to collapse. And I said, look, with all due respect, you don't know that my leg's going to collapse. And if it does, I'll be back. But right now, I'm not doing it.
Yeah.
So I put together all my knowledge of bone healing. So I had already been employing a bone healing diet and supplement program. So meaning I always follow a healthy diet, and it's important to get good levels of protein to help your body to heal. I made sure I was getting plenty of collagen, and collagen is the precursor for bone healing. Also included a lot of dark leafy green vegetables like kale and collard greens to make sure I was getting plenty of healthy levels of calcium and vitamin D and vitamin K2 from fruit and vitamin K from food, K1. And then I employed a high level supplement program. And so for me, number one, I need to take pretty good levels of supplemental vitamin D to get my vitamin D up. So,
and that's something that I've heard you speak about, that you monitor regularly, but it's important for bone healing. It's important for calcium absorption and all those things surrounding
absolutely
that.
crucial.
And it's important for a little bit of everything, but it became more important to you maybe at this time, or maybe it was just to stay the same importance, but that was a foundational one for you.
Yes. And also knowing that you need to know where your levels are, when you supplement, what happens, and then what to do from there, because it's too easy to say, oh, I just took some vitamin D and everything's fine. For some people, they could take 2,000, 5,000 vitamin D and their level might be up to 100. But for me, I take 5,000. I'm lucky to get it up to 45, 50. And then it often drops down if I'm not getting some sun on top of that. So I had to go up to 10,000 to get it at like 60, 65 level,
and
which is what I'm shooting for.
That you're in Santa Monica. So,
I know.
We talked last time about I'm in Illinois, and it was like, 0 degrees out, and it still is here. But you at least have the opportunity to get sun. But it is interesting. I just did an interview. I'm sure you've done similar with somebody that's into genetics. And he's just talking about, if he sees a lot of SNPs in the vitamin D receptor, he just might recommend that they keep theirs around 70, 80 versus somebody else might be fine at 50, 60 or whatever it might be. But it's interesting. Again, you see two people, you give them both 5,000 IUs. One of them jumps to 75. One of them can only get to 35. And it's fascinating when you follow that on labs, and we see it all the time. For me, with a focus of autoimmunity, for you too, with the focus on everything nutritionally, but also with bone healing. Now, tell me about vitamin D and its relationship. And you can keep going too. I don't mean to jump in with your stack of stuff, but I know this is part of it too. But the general understanding with vitamin D and calcium and K and things like that is that vitamin D helps absorb calcium. We need calcium. Vitamin K helps calcium go to the bones instead of going to the arteries. But I know it's a lot more complicated than that, but I think that that's generally true. But keep going with maybe your stack, or just how those things interact with each other.
Yeah, no, you're absolutely right. Calcium's an important component of bone. Vitamin D helps make sure you absorb and get that vitamin D into the bone. And then taking vitamin K, especially vitamin K2, make sure that calcium doesn't end up in the soft tissues like the arteries.
Okay.
Now, there's a lot of controversy about vitamin K.
And calcium. I feel like.
And calcium. So to start with vitamin K is called vitamin K because it was originally known as the clotting vitamin. And so there's this thought that vitamin K causes clotting and it's really unhealthy and you don't want to take vitamin K. And we know people with blood clots take Coumadin, which blocks vitamin K. So that keeps your blood thin. So if you take vitamin K, are you putting yourself at risk? And the answer is no. So you need a certain amount of vitamin K for clotting to occur. But taking more than that doesn't cause more clotting.
Okay.
End of story. So vitamin K is not a risk. Now, if you're taking Coumadin, which is a vitamin K antagonist, yes, that's a different story.
Okay.
But people who are not taking Coumadin, even people taking other blood thinners, vitamin K is not a risk. In fact, because of the fact that it decreases the likelihood that the calcium will end up in the arteries, is something you want to make sure you're getting. And people who take Coumadin actually are more at risk for atherosclerosis, even though they're blocking their risk of a clot. So you don't want to be on Coumadin for a long time if you can avoid it.
Do you monitor that level similarly to vitamin D?
Yes, we do.
Yeah. Okay.
Yeah. And so then there's a controversy about which form of vitamin K do you want to take. There's K1, and then there's at least 2 commercially available forms of K2. We have the MK4 version and the MK7 version. Now, vitamin K1 can convert into K2. The trendy form of vitamin K2 to take is the MK7 form. It's the newest one. It's the most expensive form. It has a longer half-life in the bloodstream, so it's believed to be better.
Okay.
However, the bulk of the positive research for bone healing for vitamin K is done with MK4 and with much higher levels than most people are taking today. So the average vitamin D, vitamin K supplement will have 50 or 100 mcg of MK7. What's been studied and shown to be effective for bone healing, especially in Japan, is 45 mgs, which is 1,000 micrograms. So 45,000 micrograms, not 100 micrograms of MK4. And so some of the companies now are making this available, like Designs for Health. And so I use 45 milligrams of MK4. That
was your dosage for your staff protocol? Yeah.
Yes. Okay. And I recommend that for a lot of patients. Obviously, it depends on the person, depends on testing for patients with osteopenia, osteoporosis who are trying to increase their bone density. I also utilize boron, which is another mineral that can be helpful in bone. And I added some calcium, magnesium. And as you mentioned, calcium's another nutrient that's controversial. Why is calcium controversial? We've all heard that calcium's good. It's an important part of bone and teeth. Well, for years, there was data showing that people had higher levels of calcium, had lower risk for hypertension, had lower risk overall for heart disease. And then a couple of studies came out that showed that calcium increased your risk for atherosclerosis. We know that plaque in the arteries can become calcified. So therefore, if you take calcium, is that going to calcify your plaque in your arteries and lead to more heart disease? And pretty much every doctor stopped recommending calcium. It's kind of like when the Women's Health Initiative came out and all the doctors stopped recommending estrogen. Turns out, if you're taking an absorbable form of calcium at a reasonable dosage, and you're taking it with proper amounts of vitamin D and vitamin K, you absolutely need calcium, and it doesn't put you at risk for more atherosclerosis.
Okay.
Now, you got to make sure you take an absorbable form. So you don't want to take calcium carbonate, which is the least absorbable form and the cheapest form. You want to take modest dosages, so 200 to 500 milligrams a couple of times a day, no more than that. Make sure you have good hydrochloric acid so you can break it down and utilize it. And a lot of people, as they get older, don't have good gut health, don't have good hydrochloric acid. And then we want to consider the whole concept of what if your plaque becomes calcified? The reality is, even though a lot of people get a coronary calcium scan to look at their level of atherosclerosis, that only picks up calcified plaque. calcified plaque is actually less likely to cause a heart attack.
Okay.
So when you have a heart attack, most of the time, 75% of the time, it's not because the artery is getting smaller and smaller because of more and more plaque and then finally occludes completely. It's because you have soft plaque that breaks off and forms a clot.
Yeah.
And that occludes the artery.
Okay.
So it's the soft plaque that's more vulnerable. So the reality is you don't want any plaque in your arteries. And if you do, you want as little as possible. But if you're going to have plaque, you're better off if it's calcified.
Okay.
And one of the things that statins do, not that I'm necessarily a big proponent of statins, which I'm not, but they tend to calcify your plaque.
Okay.
And that actually is a good thing if you're going to have plaque.
Interesting, but yeah. So
yeah.
So that's with calcium, and what about?
So I hadn't been taking calcium for years because I got scared off too.
Yeah,
and I was like, wait a minute.
For bone
I gotta supercharge my body's ability to heal from this bone injury. Also added strontium citrate, which is another mineral that can play a role in bone health and bone strength, and it's another controversial one for a number of reasons. I don't know if we need to go into.
I don't know any of the controversy about strontium.
Okay.
Some of these things I only know. I don't see a lot of bone health in my practice with autoimmunity and gut health and thyroid and mold and things like that. So I think this is fascinating. But we carry different products that are targeted for osteoporosis. So they're always going to have strontium. They're always going to have boron. They're always going to have some of these, players. So I know they're important. I just don't know nearly as much as you about the forms and the interactions or the controversies or things like that. But I find it fascinating because, again, you kind of figured out what really worked. And I would also say, too, just to kind of frame this all, if you had a pyramid of bone healing, your foundation, you've already said your foundation was exercise, whole food, the foundations of kind of your pyramid's almost the same as anybody's. The foundations are the foundations.
Right. Sleep, managing your stress.
Yeah. And then the next step up is maybe, just again, maybe like omega-3 fish oils or things we haven't gotten to yet, but just things that are good for everything. Vitamin D might fall into that category, but then as we keep going layers up in the pyramid, the next layer up is the bone-specific minerals. And then I think the top of it is maybe the meds or the HGH or some of the other strategies that you employed. Right. But that's kind of your pyramid, and we're kind of just working our way up that. Do you agree with that?
Absolutely.
Yeah, well, keep going because I'm intrigued by still some of the other stuff. But this is great to hear about the calcium and the different forms of K, because even in the supplement world, I always say Ford says they're better than Chevy, says they're better than Toyota, and they're all about the same from a high quality supplement brand. But the low quality supplements aren't the same. The low quality vitamin D's, the low quality, well, maybe not D, but the low quality calciums, low quality K's, the low quality fish oils are oxidized and things like that. But you're taking high quality things in high doses too, to promote this healing process.
Yeah, there's maintenance dose and there's a therapeutic dose. And you're right, you got to use quality. Otherwise, they can have contaminants. They might not have the active ingredients they say they have. They might not be in the right form. And the form is crucial.
Yeah. So, all right. So keep going.
Okay. Yeah. So moving on from, in terms of I'll just mention the controversy over strontium. Yeah, so please. Strontium is a mineral that's been shown to play a role in bone strength. Some people don't like the idea of strontium because the claim is made that it's just replacing calcium. In my particular case, I just wanted something to fill in that gap. And I didn't care if it was strontium or calcium, etc. Okay. I wanted some bone in there. Mm-hmm. And the other controversy about strontium is the data about strontium started coming in positive, and a drug company came up with a prescription version of a drug called strontium relinate. And because that turned out not to be good, everybody said, don't use strontium. So the mineral got thrown out with the bathwater because of this drug. And it was the relenic acid that was included with the strontium that was the problem.
Okay.
So strontium citrate does not have the same potential side effects as strontium relinate.
So it just got a bad rap from that.
It got a bad rap just the way calcium got a bad rap as well.
Okay.
And so then I knew I had to give my body as much help with healing as possible. And I knew about some of the bone healing drugs. The most common drugs used for bone healing, especially for osteopenia, osteoporosis, are a group of drugs that block your body's the breakdown of bone. So just like with muscle, just like with brain, constantly throughout our life, there's this balance of building up and breaking down and building up and breaking down. And we learned years ago, and that turned out not to be true, that you got all the bone you were going to get by the time you hit 25. And after that, it was downhill. Same thing with your brain. And it's not true. You're constantly building and breaking down. You have osteoblastic cells that build bone, and you have osteoclastic cells that break down bone. And you might say to yourself, why would you want to break down bone? Well, as you go through your life, as you're lifting things and knocking into things and everything else that happens, you actually have microscopic damage to your bones. And that's okay. When you work out, you create microscopic damage to your muscles. And that's a good thing because that helps set up the buildup afterwards. Mm-hmm. And so you need the osteoclastic cells, the bone breakdown cells, because they come and clean up. They sweep up your office and mop it and clean it up so the osteoblastic cells can come in and build it up. Now, the most common drugs used for bone health these days are the bisphosphonates. Mm-hmm. And these drugs block the bone breakdown, the osteoclastic activity. And so that means you're going to get more bone. But because nobody's cleaning up, you're going to get a bunch of junky bone.
Okay.
And that's one of the reasons why these drugs have some side effects. Like, for example, patients get these weird fractures of some of their bones, like the femur, actually, because the bone is not stronger. It may have more density, but it's not stronger. So you need your bones to not only be strong, but to not only be dense, but to be strong. It's another reason why when you get your bone density test, you should also ask your doctor if they can also do a trabecular bone score. And if that lab offers this additional, it's actually just a software that's included, and they can analyze the quality, the strength of the bone, as well as the amount of bone. So you want to get the TBS or trabecular bone score when you get your bone densitometer test, your DEXA scan, to measure your bone density.
Okay.
So you want to have bones that can resist fracture as well as be dense.
Yeah.
And so by blocking just the osteoclast is not the best way to help a fracture to heal. So there's only a few drugs on the market that stimulate osteoblastic or bone building activity. And so I got a prescription for a medication called Forteo.
And what's that typically used for? Is it just these applications?
So it was originally designed for osteoporosis.
Okay.
It's sort of an artificial calcitonin medication.
Okay. But it's stimulating bone growth instead of
bone growth, yes.
Bone breakdown.
Right. Okay. Right. Now, if used for a long period of time, there can be some side effects like bone tumors. So one of the reasons why it fell out of favor. However, when used for less than 2 years, the studies show it's extremely safe. And there's actually a whole new thinking about helping patients with osteoporosis as well, is by using a osteoblastic drug. And there's other drugs on the market like Avista that also stimulate osteoblasts. And you do that for a year or two, and then you can follow it with a drug that blocks the breakdown, or you can do the proper testing to see exactly what's going on.
Okay.
So you can test for whether or not your bone is being built up or broken down. So you can do the CTX test, which measures the level of bone breakdown, and you can do the P1NP blood test to measure bone formation, bone buildup.
Okay.
And so when you take a drug like Forteo, you'll see an increase in the P1NP, the bone buildup. Now, you may also get an increase in the bone breakdown. And if that's the case, then it makes sense to consider taking a drug that brings that back down for a limited period of time to get things in balance. Okay. Now, if you do it with testing, you're doing it scientifically. However, unfortunately, we don't believe in testing too much because it costs money.
Right.
Companies don't like to pay for it.
I know a lot about lab tests. I've never heard of those markers at all. Are those commonly run? Can you get those through LabCorp Quest? I mean, I think the answer
you can get those through LabCorp and Quest. Are they commonly run? No. Yeah. Why? Because insurance companies control the healthcare system, and they don't want to pay for them.
Yeah. And these meds too. I don't know about the Forteo and stuff, but I know that the bisphosphonates can be incredibly expensive. But they don't want to run the labs to monitor that. They just want to say,
these drugs were expensive for me. So I used the Forteo. Even with insurance coverage, cost me $800 a month. I had to take an injection every day for 5 months. Mm-hmm. I also elected to use human growth hormone, a low level, like 2 IUs 5 days a week. And I came to that conclusion after reading some of the data and talking to some of the smartest functional medicine people in the world. And I got the surgeon to prescribe the Forteo only after I showed him all the studies, because he wasn't really familiar with it. And there's studies showing it helps with non-union of the femur and other bones. And but he didn't want to prescribe the growth hormone, so I had a integrative doctor friend of mine prescribed that, and that was $1,100 a month. But it was all worth it. And then I got a bone stimulator that worked through an ultrasound. I put over the area twice a day. I did that for 5 months, and it healed 100%.
So that's the quick ending to the story. It healed 100%. You're back on your feet, back to normal, and
no pain, no limitations. I make sure I maintain good bone density. I hadn't done heavy deadlifts. I hadn't done deadlifts really for years, because at one time they were bothering my back, and I figured, what do I need deadlifts? I went back to doing heavy deadlifts once a week. I also do some ballistic loading. So I get up on a platform and jump down. And that's one of the things that's been shown to be really beneficial for bone.
Well, I even remember that from my undergrad at Colorado State, just, the simplest study design in the world, but they have these elderly women jump off a box, 1 foot or 2 foot, and it basically reversed their osteoporosis or improved their bone density. And it was just so simple, but the concept made sense. And I think that you start understanding some of these concepts. It's like, well, yeah, the body responds, and there's always this, again, tissue regeneration and this breakdown versus buildup. And the muscles is the easiest to see it. But it's happening in the liver, it's happening in the heart, it's happening in the gut, it's happening in the bone, and we just can't see that as much. But you can see it when you build or break down muscle, and you can also feel it too, with soreness and stuff. But I think that's fascinating. So what do you think? Let's say somebody's listening to this. Again, I just think that just statistically, the non-unions are pretty rare, but it's the same concepts of like bone health. Let's say there's a 70-year-old woman listening to this who's been told she has osteopenia or osteoporosis and just doesn't want to take meds, maybe for philosophical reasons or financial reasons or whatever else. And they're just thinking like, what can I do? What's the starting point? We talked about your pyramid, and I think that the starting point is always, real food, exercise, things like that. But what are some labs that should be monitored? What are some things that I don't want to say, I don't want to call you not a normal person, but that a normal person can do just for their bone health, Dr. Ben. And then, some of the things like the bone stimulator I'm intrigued by, but I don't know that everybody needs to do that or has the access to that, but it's still super cool. But what do you think people should consider if you're listening to this because they want to protect their bone health?
100%. So bone stimulators just for a specific injury. Yes. So you want to make sure you have a good diet that should have plenty of plant phytonutrients, so different colored vegetables. You need plenty of protein. Protein's essential for bone healing. You want to make sure you're eating foods like dark leafy greens that are high in calcium, vitamin D, and vitamin K.
Now, how specific are you personally with yourself or with your clients as far as like, because I'll admit I'm more of a generalist. I'll say, hey, you need a lot of protein, but I don't say, hey, you need 40 grams per or whatever. I don't get too specific with it, but I help people if they ask. But what are your recommendations for protein, or do you look into your micronutrients is something that's a little harder to track, I would say, from a dietary perspective, but even with your macros and things like that, how specific do you get around your exercise and healing and things like that?
Yeah, so it depends on the person, depends on the level of activity.
Yeah, okay.
When it comes to exercise, you've got to do heavy weight training. That's always a challenge because I'll talk to a lot of women with osteopenia, osteoporosis. Oh yeah, I do weights. I have my 5-pound dumbbells, and that's good, but that's not going to increase your bone density. So the Lift More trials from Belinda Beck. I had Belinda Beck on my podcast. She's from Australia. She's the only one who's really shown that you can increase bone density, and she has her clients do deadlifts, squats, and overhead presses. And they're doing 5-rep max weights. So that 100-pound woman in your office might have to do a 70-pound deadlift. And 5-pound dumbbells are not going to do it. She's got to do as much weight as she can do for 5 reps to put a strain to make the body go, wow, in order to handle that load, we have to get stronger. We have to increase the bone density and increase the muscle strength. And her program also involves some ballistic loading.
Yeah.
Now, obviously, if you have osteoporosis, you're worried about fracture, you're worried about doing ballistic loading. So you've got to build up to it very gradually. You certainly don't want to just get on a 2-foot block and jump down if you've never done anything like that.
Right. Yeah. Maybe start with steps.
So you got to work with a coach. You've got to work with a physical therapist or a highly trained trainer.
And I'm sure you agree, but the same with the lifting. If you go right to your max deadlift, you might not be able to stand up the next morning. You got to work. You can stair step your way up, and it can happen pretty quickly too.
Right.
But I started a new program last week, and I could barely move my arms because it just been a while since I'd done those motions and activities. So you got to work your way up. But yeah.
But absolutely 100%. But the bottom line is just taking Pilates, just going for a walk is not enough.
Okay. Yeah. Great to say. Yeah. So what else do they look into?
So as far as protein goes, it depends on how much a person weighs. It depends, how much exercise they're doing. And I don't know that we know for sure exactly how much protein anybody really needs. We do sometimes do micronutrient testing and look at amino acid levels, and you can get a sense if somebody's on the low side for all their amino acids, or they're, more on the higher medium side.
And you mentioned the importance of stomach acid and being able to break down those amino acids and proteins, and that's necessary. So there's a lot of different factors and components to it, more so than just like, 40 grams per meal or whatever, what might be out there. There's a lot of nuance to it.
Absolutely. Okay. I completely agree with that. I do think that vegetarians and vegans have a challenge to make sure they get enough protein. And I don't think there's enough protein just in eating spinach, even though per pound it, has a lot of protein. Nobody's going to eat pounds of spinach.
Right. And then there's a whole oxalate conversation that might tie into bone health in a different way too. But yeah.
If you really want to make sure you have good levels of protein and you're a vegan or a vegetarian, you've got to make sure you're including either protein powders or soy, or combining your legumes, having nuts, having, different forms of protein that make a nice balanced blend of amino acids like beans and rice, etc. But the problem is those foods have a lot of carbs.
Yeah. Okay. Then what about labs that people should look into? We mentioned vitamin D. We mentioned you and I haven't mentioned it. I said it once, but testing omegas is another thing that not very many people do. You know, they take like
Yeah.
one cap a day, and they're like, I take a fish oil, and we measure it. It's like they're 2.5 or something on their omega check or
Right.
omega quattro, things like that. So,
Yes.
and I know I've heard you say before that you take 6 grams a day, which
Yes.
not very many people are doing that, you know. So what are some other things just from a lab perspective that you think are foundational? I again think again as a generalist, like, and I don't want to be too generic, but like a CBC, a metabolic panel, you know, it's so rare that somebody's really dove into those. Now it's also rare that you find all your answers in those. You know, we can get a lot more
Right.
advanced, but we start with the foundations and maybe, you know, inflammatory markers, or what about just some other things? And another one too that I just want to throw out there, because I don't know. TGF beta, transforming growth factor beta is one that I commonly run. I don't know what role that has. It has a lot of role in tissue remodeling and fibrosis and things like that. But what are some other things that people can look into from a lab perspective? You know, whether it be gut health or thyroid or just bone things. You know, I think of
Well,
those
you
bone
mentioned
markers being.
omegas. So getting the omega-3 index, getting the omega-6 to 3 ratio is important too, looking at that. And omegas are so important for heart health, for bone health, for every aspect of overall health, inflammation, balance, etc. And once again, rather than just taking a pill and thinking, okay, I got it covered, what are your levels? Let's get it to the optimal range, not just into the quote unquote normal range. That's another problem with lab tests is uh, the average conventional doctor is only going to even look at your labs if they're highlighted as red, meaning you're outside of the normal range.
Yeah.
The problem is that normal range is just indicative of the average American.
Which
And I don't know about you, but I'm not trying to be like the average American.
exactly, I completely agree.
Right.
And you know how to look at, you know how to look at labs in that way with the optimal ranges, and you know you and I and others have been trained to look at those, and just instead of saying like, hey, you're not deficient in vitamin D. You know, if you're 31, you're like
Right.
not deficient in vitamin D, but it's not necessarily optimal. So, and I would call those two, you know, D and omegas, they're important because they do so much, but they're also just low hanging fruit. It's like if you're low, take more. They might not solve your problems, but you can't. It's hard to do it without them.
But not only do you need to do that, but you need to supplement. You need to supplement a reasonable amount. And then you need to test again, because what I see is patients went to their doctor, they did a vitamin D, they never ran vitamin D again. They told them to take 1,000 milligrams. It didn't move the needle at all.
Yeah.
Exactly. And they don't have any idea. And years later, they're still taking 1,000, thinking they're covered, and they're not.
Yeah. I saw someone recently with low, and she was taking 1,000. I said, it might go down at that dosage. I don't think it's going to go up, but we got to keep an eye on it. And then she took a lot. She took 5,000, which, and I usually recommend more, quite frankly, but she went from maybe 17 to like, I don't know, 28 or something. And she said, oh, I thought it would be a lot higher. I said, well, sometimes you just got to take more than that. But we can measure that and you can monitor that. So what about other, you know, bone health markers that, you know, might come on standard blood routine, you know, before DEXAs?
So
and things like that.
I don't think you're going to get most of the other bone
Yeah.
markers on a standard lab test. The serum calcium is irrelevant.
Right.
Yeah, I mean, it's not irrelevant, but it's not going to tell you anything about bone health.
Well, serum calcium is tightly regulated and plays many mechanisms, but it's not necessarily
if
related to
it's
how much calcium
even slightly low, you're in big trouble. You're going to die from your blood becoming too acidic. So the body will pull calcium off the bone to keep your blood pH in a very narrow range.
Tightly buffered, yeah.
So it's not a good indicator.
Okay. So what are?
So you can do a 24-hour urine calcium.
Okay.
You can do the CTX and the P1NP bone marker tests. Okay. You know, the problem is insurance might not want to cover them. Yeah. It might cost you $250 for each one of those tests.
Okay.
Doctors don't like to order tests that aren't covered.
Yeah.
And, you know, unfortunately, insurance companies kind of control the system.
What was the other one besides P1NP? Which one was breakdown?
CTX.
CTX. Okay. I'm writing them down because, you know, the people that come to me, they pay cash anyway. They're coming because they want to solve a problem, and the value is there. You know, if it's $500 to test these things and avoid, something down the road, that's worth it to a lot of people. Now to others, they might say no. And I say, well, cool, fine with me. Let's look at your gut. Let's look at your
Right.
D. Let's look at your thyroid, those other things. So,
Absolutely.
yeah,
HSCRP as a measure of
exactly.
inflammation.
Yep. Yep.
That's a really important one. Anything over 1 is really significant. You want to get that down low. Homocysteine is another inflammatory marker. It's a functional indicator of B12 and B6 and folate status.
You are
And
preaching my language.
you want to try to get homocysteine 8 or below.
Yep.
Certainly anything over 10 is problematic, and over 12 is really concerning.
Yeah. Anybody that's worked with me that's listened to this podcast is like, yeah, I've heard that same thing before, because we say the exact same things because they're true. It's what the literature shows. It's what we learn from our mentors and seminars and all the people you've interviewed. And so all those things are true.
Another mineral which is important for bone health is zinc. And so I think it's important to measure not only zinc, but copper, and make sure they keep in a proper ratio.
Yeah, because there's a delicate ratio there, and
right. Where a lot of us we have copper pipes, and there's a tendency to get too much copper and not enough zinc. On the other hand, during the pandemic, everybody was mainlining zinc, and some people got their copper too low. So you need to keep everything in balance.
Okay, yeah, completely agree.
But zinc is really important.
Let me ask you this: what do you think or know about, you and I have both talked about Cyrex Labs and utilized Cyrex Labs and know and respect Dr. Vijnani, but what about the osteocyte antibodies that are on Array 5? I find them occasionally. I tend to find them, and you and I have talked about this, of when you have one autoimmune condition, you're more likely to have multiple.
Absolutely.
So we find that, I would say, almost as an incidental finding. It's like, okay, you've got polyreactivity, you've got autoimmunity attacking these different areas. How much do you think that would speed this process up of bone loss, or how involved or relevant do you think that marker is? Because it's not that commonly talked about outside of, Cyrex, from what I know about bone health.
Right. I don't know anybody else that offers it. I don't run that particular test that often, so I don't really have a comment about that, but that would certainly make sense. There's a number of markers that I wish were more easily available.
Well, and I think that you agree with me that if I find that marker, guess what I'm doing? All the same stuff we just talked about.
Right.
We're looking at the gut, we're looking at your D, we're looking at your omegas, we're looking at your homocysteine. We might be saying, hey, maybe you need more calcium, K2, some more bone support because you have these bone-related antibodies. But I don't know that it changes anything clinically. I just was curious about
another test I wish was available, that's available in Europe, is uncarboxylated osteocalcin. Vitamin K2 actually carboxylates osteocalcin, and that's part of the mechanism of keeping that calcium from building up in the soft tissues like the arteries.
Okay.
And that test would give you an indication of that, but that's not available. But I do sometimes run a full micronutrient test that looks at vitamin K1 and K2 as well.
Okay. Okay. Now let me shift gears and ask you a couple other questions as we come to the end here. You excuse me. As we got on the call, I was kind of choking on fish oils because I don't know if you've ever done this. I don't know if you've ever done this, but I pop them and swallow them and spit this capsule.
Oh, really?
My rep I use an orthomolecular product. My rep showed me that, and they call it the bite test because it's not oxidized, it's not rancid. So I've gotten in the habit of just chomping them, and I show people that, and some people are like, "That's gross. I'm not doing that." But it kind of just got my throat a little bit before we started the call. But you've interviewed a bunch of people, a bunch of experts, and just with that, you came in with a lot of knowledge. You've been in practice and gleaned all this knowledge and clinical experience. I want to ask you about some of the people, or some of the maybe not specific people, but people that you've interviewed. And so I've got a list of questions, and let me just spit them all out and let you kind of answer them in whatever order you want instead of going, question by question. I wrote down, who are the most influential educators you've interviewed? And then my next question was, who are the most influential clinicians you've interviewed? And those might be two different things, and I think you understand what I mean. Is some people teach about the education, the research, the mechanisms. Some people treat the person and support the person and see good clinical results. And those two aren't always the same. But I'm curious about some of those people. Now, the last ones are just like the tools that you've learned from these same people? So that's why I'm asking these as a bulk group of questions, like some of your clinical tools that you've learned from interviewing people, not necessarily even for bone health, but whether it's, gut health, SIBO, mold, thyroid, the homocysteine, the omegas, and then some of your tools of how you apply those too. And I don't think that's too much to ask as, bulk questions, because I think you can answer those all kind of together. But what are some things that you've learned that have maybe changed your understanding or your application as you help yourself, and also as you help, clientele and, the world and things like that?
Well, let me try to answer it this way. As you get more and more into all these different experts' ways of looking at the body and these complex chronic conditions like autoimmune diseases, you can sort of get overwhelmed. And different people start at different places and focus more on this as the cause of that. And then somebody else will say that is the cause of this, and back and forth. And you can start getting confused and overwhelmed by it. And I've learned, after talking to so many different people and figuring out, okay, you start with one and you go to two. No, you start with two and go to one. No, you start with three. Realizing that it's all really a simple way of looking at the body. And some of the top original functional medicine practitioners talked about this years ago, is we're all trying to look at the underlying mechanisms why the body's not healthy. And whether you start from one and go to two, or start from two and go to one, that's not the significant factor. The bottom line is the body should be working a certain way. And if it's not, there's some underlying reason why. And it usually comes down to what is there that's keeping the body from healing that we need to take away, and what's not there that the body needs to allow it to have optimal function and heal. And so we just have to keep that in mind and realize that rather than playing the name it and blame it game, which is what conventional medicine unfortunately has come down to, is let's figure out what your diagnosis is. And I'm sure you know this. You have patients come in and go, wow, I was looking at Google and I was looking at ChatGPT and my diagnosis is this, or it might be that. And I try to get the patients to stop focusing on that.
Yeah.
And sometimes I tell them, you know what? It doesn't matter. It doesn't matter if you call it sciatica, if you call it Mary, if you call it blue, it doesn't matter. The bottom line is, how are we going to fix it? What's gone wrong in your body that's led to this condition? And let's try to do some testing and detailed history and figure out what are the things that are keeping you from healing. And let's correct those and not focus on this named condition. What is the drug to treat disease X?
Right. And I think that even, I still want to know some of your favorite tools in people, but that brings us full circle to how we started. I think that's, again, kind of the chiropractic philosophy is, thoughts, traumas, toxins, and stressors, basically. D.D. Palmer proposed that, 130 years ago, and it's still very, very true. But now we've got new toxins, we've got, new problems with regards to, whether it's EMFs or it's the food or the man-made chemicals or all these different things. But we remove anything that could be interfering with the body's ability to heal. We try to provide anything that might be necessary, like vitamin D or omegas or collagen or protein or stimulation of certain kinds, electrical or muscular or whatever. But we remove the interferences, we provide the building blocks, and then the body innately does that. That is the chiropractic philosophy. But I still want to know some of your favorite people or tools, if you have any, because I think that, again, you've it's almost like I tell people, we start from 30,000 feet up and say, hey, who are you? What are you dealing with? We zoom in on all these fine details. Now, that's a lot of the people you've interviewed, the detailed people that might be experts in this area or that area. But then we zoom out and say, it's all kind of the same thing. So
Yeah.
who are maybe some of your favorite interviews or mentors of yours even?
Sure. One of my favorite interviews was Dr. Jeffrey Bland, who, I came up into chiropractic and nutrition and functional medicine, going to Jeffrey Bland seminars many, many years ago. And he was one of the first guys before podcasts. He had an audio tape series. We would get these cassette tapes and I would stick them in the car. You probably are too young. You don't even remember cassette tapes.
I'm not that young.
Okay. So I used to get that cassette tape every month and I would stick it in the car and listen to it on my way to work or wherever I was going. And then every year, Jeffrey Bland would have the annual seminar for metagenics. And I'd go there and my brain would be just buzzing. And, my brain cells would just be on fire with all the new concepts. So he's one of the greatest educators, and he's really, if there is a father of functional medicine, he's definitely it. So, okay. You mentioned Dr. Vashtani. He always likes to separate things into a number of buckets, and he emphasizes really that you've got toxins, you've got infections, and you've got food sensitivities. And those are three of the important buckets. I would say gut health and blood sugar regulation are two of the others. And I think if you focus on those five, you're going to get a lot of the imbalances in the body right. So that's one way to look at it.
Yeah. Well, okay. I think that's good. Those are some of my mentors, some of my heroes, same things. And I don't know.
I've listened to Dr. Mark Hyman for years and years. I never got a chance to interview him, but he talks about how he would have clients that he was seeing for functional medicine, and a lot of times he didn't do anything super fancy. He put them on a multivitamin and a fish oil and maybe a vitamin D and a probiotic and clean up their diet a little bit, and miracles would happen sometimes.
Well, and I think that brings us full circle to wrap it up, Dr. Ben, is that, we are chiropractors. We appreciate the chiropractic philosophy, but you get in a room with these MDs and DOs and naturopaths and health coaches, and we're all kind of saying the same thing, because the more that you look at it, the literature-wise, the more that you look at it common sense-wise, the more that you see it applied clinically, the more you realize, like, this is kind of how it works. The body's trying to heal. You put the body in the right position to heal. You look for what might be blocking it to heal. So we're all kind of playing the same game and on a level playing field, even though one person might be more into bugs or one person might be more into toxins. That's where I think we can get a little divided too, as far as like trying to focus on one niche area as far as a root cause, when it's really a lot of these things that can, play synergistically together.
And I think it's important to keep an open mind and not just get boxed into one way of doing things.
Yeah.
That everybody has this or everybody has that.
Yeah, I completely agree. They say to a man or woman with a hammer, everything looks like a nail. And so even if I see somebody that, is suspicious of mold, and I see a lot of mold, so I just tell them that. I say, hey, that's on our radar, but we want to think about what else. We want to breathe clean air, for sure. That's a necessary part of being well, but we don't want to just only exclusively put it, 2 air doctors in every room and expect that you're going to get healthy and well. You got to do a lot of other things. And it's knowing that some of those things.
Yeah, you don't want to have one tool. You don't want to be the radiologist. Yeah. Everybody comes in your office with cancer and they're getting radiation because that's what you got to offer.
Yeah, exactly. So, all right, well, this was great. This is really helpful. I really appreciate it. So tell people where they can find you. The Rational Wellness Podcast is everywhere out there. You've got a ton of good info. You got a ton of good episodes. Where should they
appreciate that?
Check you
out? They can find out about me and get in touch with me from my website, which is drweitz.com, drweitz.com. You can call my Santa Monica chiropractic office at 310-395-3111. And we can set you up for an appointment for a consultation for functional medicine or for chiropractic. Okay. And I appreciate the opportunity to come here and chat with you and your listeners.
And then the YouTube and podcast it's Rational Wellness Podcast. I can see it behind your head there.
Yeah, absolutely. Rational Wellness is my podcast I've been doing literally for 9 years, have over 440 episodes, and it's found everywhere. It's on Apple Podcasts, Spotify, YouTube, etc.
Well, I even think that that part is cool that you've done that many episodes. You've been in practice as long as you have. You've got all the info and education that you have, and
And
it's
I'm still
still,
as excited as I
and
was from
yes,
day one.
and it still comes back to, the basics first, and then there's these advanced strategies. So I love that concept because we're trying to, sometimes I don't say pound that into people's heads, but just get them to understand that. And like you said, instead of name it and blame it. And so I love everything you said today. Thank you so much for coming on the show. Appreciate you, and we'll talk soon.
Thank you.